Hey, what's up?
All your favorite artists.
Check it out.
Say my name.
DJ Khaled.
This is Mila J.
Bruno Mars.
On hot7025fm.com.
What's going on, everybody? It's your main man, 360, the poet from the Morning Wood, and I'm here to talk to you about the Sci-Fi Center. It's your Vegas home for science fiction, horror, and fantasy. From comic books, toys, and posters to movie screenings and live events, they've got you covered. Located at 900 Cameron Avenue, Suite B209, give them a call, 702-900-4335, or reach them at thescifcenter.com.
Keep your radio dial right here. You're locked into the hottest news station on the planet. Hot 702.5 in FM sound. Blazing today's hip-hop, R&B, and pop music. Keeping your radio on fire. Bringing you the hottest, realest, riskiest talk shows live 24/7 on hot7025fm.com.
Hey, everyone. Happy Wonderful Wellness Wednesday. It is your girl, Artisha, and welcome to the Uterus Bar. If you are new, welcome on in. If you are returning, hey, welcome back, family. Listen, I hope you guys are doing great out there. Before I start off, I just want to say, give love on your family, you guys. Love on your loved ones. Please, let me say it again. Love on your loved ones. Love on your family. I want to say rest in power, Mama Shirley Amos. She is my sister-in-law's mother, my Lanisha Wright. And also my best friend's mom, Shamanika Quila Jackson. And she's left behind a legacy. She's left beautiful children behind, beautiful grandchildren, best friends, cousins, and relatives behind. And we know that you are looking down on us and loving us. But I just wanted to take the time to just say you are truly going to be missed. Mama Shirley, you are one of a kind, and we just love you. All right, you guys. With that note, I do gotta drink some tea. Let me drink some tea, y'all. That Let Lymph Flow Lymphatic tea. You can purchase that on 208lymphatics.com. Also, I want to talk to you guys about some other things because something has been going on with me after I had my hysterectomy. So I had my hysterectomy in April of 2023. And because I still have my ovaries, and I did not want to give up my ovaries because I was told, hey, if you give up your ovaries, girl, it's going to throw you straight into having your own private summer, which is called menopause. And we're going to be talking about menopause coming up in some of our future shows. But I started feeling like I was having these ovulation pains because I still have my ovaries. So this is just what I'm thinking. I'm just thinking every month I'm just having these ovulation pains. And I'm like, man, this stuff is getting stronger and stronger each month. And so in the month of December last month, I noticed I was came from having lunch with my mom and my little one, and I just was bent over, and I was like, oh my gosh, I'm in so much pain. And then I was like, no, I gotta lay down. Something is not right. Okay. And then it passed. Like I had my, I've been attached to my little heating pad, y'all, like a little lady, like a little old lady. But listen, those heating pads, I love them, especially the ones you could attach it to your underwear and you just walking around, or the ones that you just plug in, or they got the one that's portable where it's like a little belt and you just walking around with that too. But yes, I am in love with having a heating pad. So I have my heating pad, was drinking my tea, and I did take a pain reliever also to help me. And then here it goes again. It happened this month. Matter of fact, today is Wednesday. This happened to me, I believe it was Monday. Yes. And I was like, Now, you know what? Excuse me. What in the HELL is going on here? So I said, you know what? I'm nosy. Let me start being my own superhero and my own advocate to see what's really happening, what's going on in my body. Well, I found out that what causes pelvic pain and cramps years after having a hysterectomy, and right after, not just years, but what happens after. So this is what I found out. So how common is pelvic pain after a hysterectomy? So women who undergo a hysterectomy to relieve unpleasant symptoms are often just trading some painful symptoms for others. Let me repeat that. We are trading some painful symptoms for others. So once the uterus has been removed, among patients who have took part in a survey, so this is what it's saying, conducted nationwide about pain after a hysterectomy. So almost 12% were experiencing pelvic pain that persisted even after 6 months. And that number rose to over 32% after a year. Let me take a sip on this because we're getting ready to dive deep, y'all. And y'all girl over here has been going through it every month. Excuse me. And I was thinking that, okay, y'all, I'm still ovulating. I still have ovaries. No. Let me go ahead and break it down and tell you what it's really called. So it's called ROS, residual ovarian syndrome. Okay. So this can occur if one or both ovaries are left in place during the hysterectomy. ROS causes symptoms of chronic pelvic pain and the formation of a mass, and can also cause pain during sexual intercourse. So during sex, I'm not having the pain. It's just that monthly, like if I'm getting ready to ovulate, and it's, to me, I feel like it's worse. So ladies, you know how when you do ovulate, you maybe feel like you're ovulating on one side, your right, or maybe the left, or even both. And you kind of feel like, oh, I feel achy, I feel crampy, I'm not feeling my best. And you're like, oh my gosh, this just need to pass. It feels worse than that. Like I said, it had me bent over. And this time, I was in fetal position. Like, wait, this can't be. All right. So as many as 50% of women who experience ROS end up having additional surgery within 5 years to alleviate their symptoms. I wish I was told like, hey, Artisha, these are the possibilities of actually having a history. These are the symptoms or the possibilities that you may experience after having a hysterectomy. And I wish that some of these providers would educate us about this, because maybe I probably would have said, well, no, or think about the other different procedures that you do have, and you're not told, hey, guess what? This can happen if you have this surgery. This is a possibility. How many of you out there probably would give it a third thought, a fourth thought, a fifth thought, and may research other different options? But sometimes we're not told that, and we just move forward. And then, just like they said, we're trading off pain. We're trading something else for a different pain. Okay, now, and around 75% experience pelvic pain 10 years after a hysterectomy and require surgery. About 77% of patients with ROS have ongoing abdominal pain, with almost 70% experiencing pain during intercourse. So this was a typical case. This case right here was reported of ROS. So a 35-year-old woman, she had a vaginal hysterectomy to ease heavy bleeding and other symptoms due to adenomyosis. But her normal, healthy-looking ovaries were left in place. Within 2 years, she began experiencing persistent pain in the lower left portion of her abdomen. Okay? And sought additional treatment. Imaging scars revealed a cyst-like mass that was about 4 centimeters in diameter. And she was diagnosed with ROS, with treatment consisting of painkillers and observation. I hope you guys are paying attention to this. After 3 months in chronic pain, surgery was performed to remove both the cyst in the left ovary and the I can't even speak right now. Fallopian tube. And I pause right there because I feel like sometimes we could be also misdiagnosed or not diagnosed at all. I feel like a lot of women, we do suffer in silence because we think it's normal. You know, it's a part of my menstrual. This is what I've been going through. And not realizing it's a condition. It's a syndrome. It's something out there that really resonates to what you are actually going through. Okay? Y'all, I got to sip on this tea, y'all. This let lymph flow lymphatic tea. Man. You can purchase that on 208lymphatics.com. Okay, so here's another thing. So ovarian remnant syndrome. Okay, so this is something different. Another less common cause of pelvic pain and cramps years after hysterectomy is a condition called ovarian remnant syndrome. This can occur after the removal of both ovaries, where a small amount of tissue from the ovary remains behind and remains somewhat functional. This can result in the formation of cysts and ongoing pain in the abdominal or pelvic area. Man, it's like we going through stuff out here, ladies. We are really going through a whole lot, and we're just told to just continue to be strong, continue to be strong. Take painkillers, they say. Continue to be strong. You're okay. But I do want to say this, and this may ruffle some feathers. I feel like if a man goes to a doctor, because a lot of men, they don't like going to doctors. So if a man goes to a doctor and he says, my arm hurts, they believe him. And I feel like they roll out the red carpet for them too. Oh, your arm hurt? Let me go ahead and give you some coffee too. Let me go ahead and set up that pretty Band-Aid. Do you want to kick back and watch, sports while we take care of you? But when a woman complains about any symptom, we are looked as like we are fibbing. We are looked at like, oh, you're okay. You could take the pain. It's all good. We are looked at like, okay, here she go again with that complaining. And let me just go ahead and this is what this is. This is what's going on. And we're going to go ahead and just sing you about your day. And you can go ahead and pick up your prescription at CVS or Walmart or wherever you're going to. And that's it. We don't get the red carpet rolled out for us. It's just pretty much like, okay, here she goes again complaining. And you're strong. You got this. All right. Now, abdominal cramps years after hysterectomy that feel like PMS are prompted by a fluctuation in hormones. If the ovaries are left intact, they can still produce and release these hormones. In case cramping, bloating, and other PMS symptoms, even though the uterus has been removed. Some women can feel menstrual-like cramps years after total hysterectomy, are confused because they no longer have ovaries. Although the ovaries are the main hormone-producing source that drives PMS type side effects, such as cramping. Other organs, such as thyroid, produce hormones that may also prompt symptoms like depression, bloating, and irritability. Pre-existing conditions. It's another thing, which is PID, pelvic inflammatory disease or endometriosis that existed before the surgical removal of the uterus may continue to cause discomfort. Discomfort and chronic pain in the lower abdominal or pelvic region. Additionally, the pain caused by these conditions can be exacerbated by the formation of scar tissue resulting from the surgery. Y'all, when I tell you I had to start doing some digging with that, it's like, what is going on here? And why am I going through this? And why no one let me know, just inform me about this. So this is what I talk about. I'm the information giver. I'm the storyteller. Yeah, I'm about to give you the information because it's free to give information, right? Like, you need to know this. And then now you can go and hand like, okay, you know what? I researched this and this is what I feel like I'm experiencing. Because we, as women, we feel like the doctor should be our advocate. But no, you need to start being your own advocate and start doing your research and making sure that your voice is heard, because your health matters, you guys. Your story matters, your voice matter. And we have to start taking our health seriously and pushing through instead of just saying, okay, I just think this is what this is. And so I am going to go get some blood work drawn. I need to go see my OB. And I need to get blood work done. I would like to have an ultrasound done. I want to know what's actually happening, you guys, because it's been, like I said, since 2023, April 2023 is when I had my hysterectomy. And here I am just thinking these different symptoms are normal, right? And they're not. And I'm finding out like, oh, girl, this is not, you're not ovulating. This is some other stuff you have going on. Girl, you got ROS. I'm sitting there diagnosing myself because, no one was telling me about this. So, yeah. So, and just for those that do not know, every year, 600,000 women have hysterectomies every year. And the highest race is those that look like me with this beautiful melanin skin. 16.4%. Okay. So you can look that up on the CDC. It'll tell you the whole breakdown, and or you can go back to one of my very first episodes and I break it down more and more about that. So what other conditions can occur besides chronic pelvic pain after a hysterectomy? Pelvic floor dysfunction. And so this can cause long running pain in the pelvic region as well as urinary incontinence, and can also create pain or difficulty during sexual intercourse. So for those of you that do not know that, you need to go get if you feel like, okay, every time you're coughing and sneezing and leakage is falling out, go get seen, sis. Okay, go get seen by a professional that specializes in pelvic floor dysfunction. Prolapse. Pelvic organs can drop down, okay, becoming displaced from their intended location after the removal of the uterus, and it can cause vaginal tissue to protrude outside of the vagina or affect the bladder or bowels. Y'all, it just keeps going and going and going. Increased risk factor for many serious conditions. While removing the ovaries can reduce the risk of ovarian cancer by almost 90%, and a hysterectomy can relieve some debilitating symptoms, there are also many potential negative long-term side effects. And we're about to break this down. And also, you guys, this month in January, I want you guys to go and get your annual exams done. Go get your pap smears. Go get this done because this is ovarian cancer month. Uterine ovarian cancer month. Okay. And early detection can truly save lives. Hysterectomy risk for future complications with removal of ovaries before 50 years of age. Lung cancer, you guys. Percent of elevated risk, that's 45%. Heart disease, 33%. Memory issues, 60%. Stroke, 62%. Parkinson's disease, y'all, 80%. Osteoporosis, 50%. Sexual dysfunction, over 40%. Man, nobody got time for that. Nobody wants that. Okay? Nobody wants that. Now, before I move on to my next topic, you guys, this weekend, I'm really excited. I am going to be hosting. So the Uterus Bar presents Women Health. support group. So if you are in the Las Vegas area, I would love for you to come and be a part of this. When I was having my hysterectomy, or even just before then, when I had my fibroids and my uterus was a size of a pineapple, walking around like a pregnant lady. I didn't have support, and I wish it was something that, because I was looking, I wish it was something that was out here where I was in Vegas, or even just online for me to feel comfortable, right, and have that support. So anyways, this Saturday, you guys, I'm going to be hosting a women's health support group, and this is going to be monthly. Okay. And you are going to be, introduced to other women that are experiencing the same issues or different issues. You're going to be able to have question and answer time. And the topic we're going to talk about, you guys, is medical gaslighting. Okay. Because they gaslighting us out here, sis. So we need to be prepared. We need to be informed. We need to have resources. And what better way to do that is to come together and let's talk about, let's get real. Okay. Because our health matters. This is a time to take care of your health. And in a special attendance, we're going to have some special guests. Yes, of course. The Uterus Bar book will be there. You can purchase that, my love. That's going to help for those that are planning on having a hysterectomy. And it has checklists and nutrition and things like that. Let Lymph Flow Lymphatic Tea is going to be there. And of course, my newest baby, Artisha's Blossoming Womb Tea. And so all these different issues that we are having, our reproductive concerns, let me tell you, it's really helping out with that. My mom, she's going through her own private summer, as we call it, menopause. And she's been taking it for, I would say, 2 weeks now. And she is seeing some amazing results with the hormone balancing. So I'm really happy to be able to help my mom out, because listen, nobody got time for this menopause. I don't even know where she came from, but nobody has time for this. It's just too much. Another thing I wanted to talk about. So I want to see you guys there. It's going to be on Lola's Louisiana Kitchen. Great food, great people. I can't wait to see you guys there. Okay. Another thing I want to talk about is swollen belly after having a hysterectomy. Okay. Having a swollen belly after having a hysterectomy. Y'all, this is real. And it's not just, you full of it. No, it's having a swollen belly after having a hysterectomy. So let me break this down. So most women find that their belly is swollen after a hysterectomy for several weeks, while others experience a swollen belly 3 months or even a year after a hysterectomy. Now, let's look into some reasons why this might happen in a way to prevent it entirely. So this is what is being reported. Some general information about hysterectomy surgery. So operation involves removing a woman's uterus as a treatment for gynecological conditions, right? So about 10% of the time, the uterus is moved as a life-saving intervention. 10%. So what is the 90%? Interesting. Such as cancer. But as far as the other 540,000 hysterectomies that are roughly done here in the U.S., they are done to treat benign conditions. Okay. So the uterus is not just a womb. So this is how they breaks it down. Research has already revealed some of the complex relationships the uterus has with the woman's heart health and memory functions. If a hysterectomy is performed when a woman is younger, her risk of a heart attack and stroke is significantly increased. You know what? I just cannot. It's just too much. Can we get a break, ladies? Damn. Oh my gosh. We trading things off. JAMA, Journal of the American Medical Association, published an article on their website relating information regarding some research findings showing that women who had a hysterectomy and transitioned into menopause prematurely had a higher risk of early memory issues, including dementia. Not today, Satan. Let me tell you, I'm about to get on that ginkgo biloba. We're not doing this. No. So issues that you may face after losing your uterus. And so here's a bunch of potential complications, you guys, and I'm about to break them down. Some long-term side effects of a hysterectomy may include loss of bladder control. So remember, we're talking about you laughing or you sneezing or you coughing and you have leakage coming out. Frequent UTI infections. Now, I want to talk to you about that really quick too. So, and it's also in my book, The Uterus Bar, because I did not know, you guys, that was something that would be common, UTI and also yeast infection. Because you got to think about what was taken out. So vitamins have to be in your system. Herbs to be able to flush out toxins need to be in your system. Water. I know some of y'all don't like to drink water. You may trade vodka with water and say it's water. But no, water, you guys. Having, you're changing up your diet can really help. But what I'm saying to you guys is it is increase. And when your pH balance is off due to you not having your uterus, due to you having a hysterectomy, these are the things that are happening. And again, you're not being told or informed or giving you some type of education pamphlet, something, or education course. Oh, wow. Come through, Spirit. An education course to gear you up, for what's to come after. All right. Frequent UTI infections, different types of sexual dysfunction, depression, hormone imbalances, pelvic floor weaknesses, vaginal prolapse, chronic pelvic pain, symptoms of menopause, loss of fertility. And so that's the long-term side effects of having a hysterectomy. But 2 episodes ago, remember I shared with you being born without a uterus. You can still have a baby. You know how? For those that didn't watch it, I'm getting ready to tell you. You can have a uterine transplant, and it's for women that were born without a uterus. If you had a hysterectomy or you had some type of infection going on with the uterus, and you have to take it out. So it's some things that you can still do because it says loss of fertility. Now, short-term side effects you may face immediately after surgery or longer include pain, infection, bloating, swollen belly, constipation, and vaginal discharge. So I had the pain. I remember having that. I didn't have an infection. Thank you, Lord. The bloat was real, y'all. The constipation was real, y'all. Fiber, I had to really beef up with that fiber because it is just, And the swollen belly, I kind of still see the swollen belly, but not as bad as I saw it before. And the vaginal discharge is, I have it and I'm not dry. So I'm thankful for that. But for those, you may be, you may have that and you may, your hormones may be out of whack. So go get seen so you can get some assistance, you guys. So one of the side effects that women are often surprised to discover in their swollen belly after hysterectomy, after having a hysterectomy, many women find that they are still dealing with a swollen belly 1 year after the hysterectomy, and they turn to social media for answers. Right? These women say they didn't know this would happen, and I'm one of those women. Right? And are looking for answers and advice from others who have had this surgery. And this is why, you guys, we're having this group, the support group, because we need it. Maybe someone else can enlighten you about what is actually happening. And hey, everyone that's out there listening, hello to my amazing listeners and amazing viewers. I see 116 of you guys. Thank y'all for rocking with your girl. All right. So is this normal to have a swollen belly? So what is being reported is, yes, it's very common. Okay, for women to experience belly bloating after having their uterus removed. Each woman's body will react differently, you guys, to their particular surgical experience. But everyone deals with a swollen belly after hysterectomy for at least a few weeks. However, some cases are going to be longer. Okay, so this is also okay. So if we're having this swollen belly, what is really going on here, and why are we having this swollen belly? Like, I really want to know, like, what's up? You know, the biggest reason why I found out, y'all, gas, digestion issues. Okay, so let's break this down. So the surgical team, so this is what's causing it. The surgical team often inflates the patient's belly with gas during a hysterectomy to help gain visibility and access to the uterus while removing it. Did y'all hear that? Did you know that? So in order to have this procedure, the surgical team needs, to be able to see the uterus, they inflate gas. Also during the surgery, the intestines and other surrounding organs may be moved around a bit. I'm gonna get back to this, but I remember having my emergency C-section, and I remember my husband saying, like, man, I remember seeing like this big, it was a huge fibroid, and they safely got our little guy out, and of course all my other organs, they just plop that stuff right back in there and just like, okay, here we go, plop plop. And a little later, I did go through some type of complications because of them just plopping stuff around. And I'm thinking of medical gaslighting. Even though I had an amazing doctor, but I still was being gaslighted, you guys, by what happened. And so after you have a baby, you usually have that little band that they give you, or a band that you purchase. And I remember wearing it. I think our little one's maybe like over 6 weeks old. And I just remember putting it on. And I remember just feeling so clammy and just, oh my gosh, like dizzy. And I was like, oh no, Lord, you can't do this to me now. I done had this beautiful little boy, and you about to take me out now, Lord. No. And so at the time we had stairs, like wooden stairs. I remember my little one's laying, my husband was downstairs, and y'all, I remember crawling from upstairs to downstairs. And I remember like vomiting. I had to take that binder off. I felt somebody had did some voodoo on me. I said, no, what is going on here? Like something is really happening. And so the only thing I remember taking a Norco, and that's really strong, right? It knocks you out, and it was helpful for the pain. But when I went to go see the doctor, he was like, oh, that's just probably that was just gas. I said, nah. Ooh. Jesus, help your people. You see, that's a term, that's a form of medical gaslighting. Because what if it was something else? And let's keep on moving, y'all. Let's keep moving forward. Okay. So where I stopped at, you guys, was when I talked about the intestines being surrounded and just kind of move around a bit, which can upset their normal function and cause a slowdown in digestion. You see, so resulting in a swollen belly. So most women are aware that they may be bloated and gassy for a few days. I've told you guys I was gassy, constipated, and this is why it's really good for the fiber. You definitely need fiber. So after hysterectomy, but many are not expecting to deal with these side effects for several months or even a year. So, wow. So the bloating can be residual gas that was used during the operation and needs to work its way out. It can often cause abdominal discomfort and pain in the shoulder area. Wow. The use of anesthesia during the operation and painkillers afterwards can contribute to constipation. You see, I'm telling y'all, which often causes belly bloating after hysterectomy. So longer term bloating can be the results of your body's normal healing process, which includes the excess buildup of fluids. Additionally, scar tissue can create inflammation and cause extended bloating after hysterectomy. Wow, you guys. So the side effects may last several months or longer, and women have reported having a swollen belly for a year after a hysterectomy. What do you guys think of that? So here are, it's a lot. It is a lot. Now, this is a couple different reports from women that were talking about having a swollen belly after having a hysterectomy. So my surgery, here's patient, we're going to call her patient A. My surgery was 3 months ago, and I'm still dealing with a swollen stomach after my hysterectomy. I have been back to my normal exercise routine for almost a month, but still look 6 months pregnant. The struggle is real. Here's patient B. My surgery was almost 7 months ago, but I remember the third and fourth months. I had serious bloating. After my hysterectomy, I am seeing a pelvic floor specialist, and that is helping with some of my issues. And here is patient C. The stomach bloating after hysterectomy can last a long time. I had some swelling that lasted almost 4 months, and it seemed to come and go depending on what I was doing. I asked my doctor about it and was told the most people get this, and it usually takes between 3 to 6 months for a swollen stomach after hysterectomy to go away, but it could last a year. Now, you know what? I like patient C's doctor that was able to break it down so patient C wasn't just in the lost or in the dark, or, just walking around. And what I can say about the digestion system is so true. If it's moving slow, you need something to really help. And that's what we're talking about. Things that we're eating, things that we're drinking. And those toxins are sitting there too. I got something for you with that Let Lympho Lymphatic Tea. Get it on lymphatics.com. Okay. Now, can you avoid this? Is this something that can be avoidable? They're saying, unfortunately, a hysterectomy may be necessary to preserve the lives of some women, right? So depending on the circumstances. However, a very large number of women have their uteruses removed to put an end to excessive bleeding and other symptoms resulting from benign conditions such as uterine fibroids or adenomyosis. The best way to avoid this unpleasant side effect is to avoid this uterus removing surgery completely. So we did talk about some past episodes ago about UFE, uterine fibroid embolization. And what that does is they'll take a little slit where your wrist or your thigh area, and pretty much it kills off the blood supply to those fibroids. And if you are out there experiencing fibroids, that is something that you may want to look into. So it's called uterine fibroid embolization. And it's also called uterine artery embolization. Okay. So it's saying it's outpatient. It can eliminate these symptoms without surgery. The uterus is left in place and there is no inclusions or long-term side effects, such as a swollen belly. Okay, like how they have after hysterectomy. And they're saying it's safe and it's effective and can help 80% to 90% of women with adenomyosis and uterine myomas without surgeries, okay? Or without having a myectomy. So that's something that I wanted to bring to you guys. Very interesting, very, very interesting things. This is also being reported by the Cleveland Clinic, you guys. And I wanted to go over, because I keep saying that word adenomyosis. I know you guys are like, wait, what is this? What is adenomyosis? So here it is, the Cleveland Clinic. I'm getting my information from them. Adenomyosis occurs when tissue from the lining of your uterus grows into your uterine wall. It can cause your uterus to double or triple in size. Symptoms include heavy periods, cramping, and painful sex, and is typically treated with medication or surgeries. Okay. Now, I'm going to show you guys this little diagram if you could see it. If y'all see it, here we go. And it's showing you what a normal, this side is what a normal uterus looks like, okay? And on the left side is showing you what adenomyosis. So let's break that down. Adenomyosis occurs when tissue from the lining of your uterus grows into the uterine wall. All right. It can cause your uterus to double or triple in size. Symptoms include heavy periods, you guys, cramping, and painful sex, and is typically treated with medication or surgery. So I want to at least be able to show you guys what this looks like. So on this side, the right side, it's normal uterus. On the left side, adenomyosis. That's what it's looking like. Okay. Now, how common is adenomyosis? Many women and people assign female at birth. AFAB aren't aware they have adenomyosis because the condition doesn't always cause symptoms. Now, however, researchers know it's more common in people who have had a procedure on their uterus or older than 40%. Okay. Interesting stuff, you guys. Interesting things. So, approximately 2 to 5% of adolescents with severely painful cycles have it. Okay. And another thing, here are the symptoms and causes. So here we go. The signs of it: painful menstrual cramps, heavy menstrual bleeding, abnormal menstruation, pelvic pain with or without severe cramping, painful intercourse, infertility, enlarged uterus, bloating or fullness in your belly. So that's what we're just kind of breaking down before when we were talking about having a swollen belly, you guys. So what causes this? So researchers don't know why some people develop adenomyosis or what causes it. However, some research suggests hormones, genetics, or inflammation, trauma may contribute to adenomyosis. All right. So what are the risk factors for this condition? Have had prior uterine surgery, such as uterine fibroid removal or dilation of clitoris, which is DNC, or have endometriosis. All right. So, you guys, what are the complications of having adenomyosis? Heavy menstrual bleeding from adenomyosis increases your risk of anemia. And anemia occurs when your body doesn't have enough iron-rich red blood cells. Anemia can cause you to feel fatigue or cold. Now, diagnosis and tests with this. How is adenomyosis diagnosed? Having a pelvic exam, ultrasound, image scans. And we're not just talking about the ultrasound that just goes over your belly. We're talking about the transvaginal ultrasound that they kind of put like this rubber, I guess, condom, put the little jelly, insert, and it uses sound waves to produce images of your pelvic organs. And these images can sometimes show thickening of the uterine wall. So can it be treated? This is what people want to know. Can this be treated or managed? So because the hormone estrogen promotes endometrial tissue growth, okay, adenomyosis symptoms can often go away after menopause. So this means that you got to wait. So it's just so many different things. So in the meantime, these treatments can ease pain and help with heavy bleeding and other different things that you're going through or that you're experiencing with it. And this is what this is: pain meds, hormonal medications, non-hormonal medication, and adenomyomectomy. There we go. There's the removal. Surgery to remove adenomyosis from your uterine muscle. This procedure is similar to the myomectomy, which removes uterine fibroids, or they're saying just get rid of your uterus, having a hysterectomy. But what happens, you guys, if it's left untreated? Okay, so after this, we're going to wrap this up, but I want to tell you, this is what happens. So when it's left untreated, adenomyosis can lead to infertility or miscarriage. And this is because the embryo can't implant into your uterine lining. Other problems may include chronic pelvic pain and abdominal pain. You guys, thank you so much for allowing me just to pour into you guys today and talk about these topics that you may have not known of. It's really a lot going on here. And again, I want you guys to do your research. We are our own advocates. If you are not in the Las Vegas area, get in some type of support group. Get in some type of support group. Ask your OBGYNs. They may know of some type of support groups that you need to have support when we're dealing with these common reproductive concerns. It's really, really, really important that, again, that we go over this and we know and we're our own advocate, because no more women, no more ladies, no more sisters, no more that we go into the doctor's offices and we look at them like superheroes with a cape, or that they're going to be our advocate. No, it's time for us to be our own advocate, our own researcher. It's important. Okay, you guys, I hope to see you guys as we wrap this up. I really hope to see you guys this Saturday at Lola's Louisiana Kitchen, as it's going to be our first, not our last, but our very first women's health support group, as the Uterus Bar presents that. And again, grab your book, grab your tea. You can grab that both there. And then the new tea will be up on the website in the next week. Okay. Thank you guys for tuning in. And if you have any questions, please, no question is too big or too small. Please email me at the Uterus Bar at hot702.5, at hot7025fm.com. And you can catch me every Wednesday at the hottest radio station in Viva Las Vegas, Hot 702.5 FM. Bye, you guys.
Keep your radio dial right here. You're locked into the hottest news station on the planet, Hot 702.5 in FM sound. Blazing today's hip-hop, R&B, and pop music. Keeping your radio on fire. Bringing you the hottest, realest, riskiest talk shows live 24/7 on hot702.5fm.com.